Are you currently suffering from pain on the inside of your foot or ankle that's exacerbated by activities such as walking, running, or prolonged standing? If so, these are common symptoms of a thing called posterior tibialis tendon dysfunction, also known as posterior tibialis tendonitis or tendinopathy. And this can be very debilitating and frustrating. For those who don't know me, my name is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. And this video is going to be comprehensive and cover everything from symptoms, causes, rehab, and then surgical options. Let's review our anatomy. If you look at our model of the foot, we have the two bones of the lower leg. This larger one's called the tibia, and the smaller one's called the fibula. And then there's the bones of the ankle and foot. Now this tendon, represented by the tube here, is the posterior tibialis tendon, and it originates up in the posterior lateral compartment of the leg, runs down under this large bone on the inside of your ankle called the medial malleolus, and attaches to the bottom of the foot on several bones. And this black portion is the portion that's most likely affected, and that's going to cause your pain. Now this tendon has three primary functions: pulling your toes down, known as plantarflexion, rolling your foot and ankle in, known as inversion, and then pushing your leg inwards, called adduction. It also helps stabilize that middle arch during things like walking and running, and the toe especially in that late stage of push-off. This can be caused by three main things. So the first is trauma. Think a severe rolling of your ankle or stepping off a curb awkward. The second is this kind of gradual onset, so basically overuse. Now with this, we want to use the word tendinopathy, not tendonitis, because this is a mechanical overload. More load is placed on the tendon than it can handle, or the capacity. So inflammation is involved, but if you attack this with purely anti-inflammatory treatments, it's not going to help. And then the last one is this awkward kind of giving away, like you step weird, or there's just this sudden movement that doesn't quite feel right. That can also cause this condition. There's actually three different presentations with this. So the most common one, and the one that will be addressed in this video, is an overuse of the tendon under that medial malleolus bone. And the second one is there's a deltoid ligament. So there's this big thick ligament that supports your ankle. Think about how it's much harder to roll your ankle in than out. Well, if there's severe trauma and injury, that tendon gets thicker and that scar tissue can compress on that tendon. Now that's a different issue and often surgery is needed. And the last one is we get these little accessory bones. We can get one called the os navicular on this navicular bone, and that can pinch on the insertion of this tendon. And I've had a few people that have had this condition, and the x-rays show that bone, so that's the diagnosis, but really it's the bone pressing on the tendon, and it can be very painful and sudden and kind of random. So if you feel like that's a presentation, make sure they're not just looking at the bone, but the tendon too. With this mid-portion tendon issue, the pain is going to be primarily over the inside of that foot or ankle, under that large bone under the medial malleolus, but it can also kind of radiate into the heel or up into the leg a little bit. And the more you use it, the worse it's going to be, especially on uneven surfaces with walking and running. Now the three cardinal signs with tendon pain versus other kinds of pain is first, it gets better as you warm up. Get out of bed first time in the morning, step out of your car after a long car drive, those first steps can be the worst, and then as you take more steps, the pain should dissipate. Secondly, a load dependent response. The more you push it, the harder the tendon is loaded, the more the pain is. So if you do something at 50 pounds, 100 pounds is going to be more painful, and this is different than other conditions. And then lastly, it improves with rest. If you unload the tendon, you're going to feel less pain. And in more severe cases, when that tendon is elongated or not working, the inside of your foot arch collapses. And what happens here is, as you can see in this picture, your ankle kind of pushes in and the outward toes kind of push out. It's called the too many toes sign. So if you look from the back and you can see some people's toes on the outside, that's indicative that the arch is collapsed and the tendon's not working. With tendons, since it's a mechanical overload, often before exercises you need to calm them down. So the first thing is load management: frequency, duration, and intensity. Probably if you have this, you started a new running program or you've increased your intensity. The best thing to do is temporarily reduce it by 50%. Some other things that you can try are NSAIDs, if not medically contraindicated, ice, and then taping, orthotics, and braces can be really helpful. Here's a few examples, but these can help support that arch and take some pressure off the tendon, letting it calm down faster. Here's the equipment that you should have for this video. So a bench, if you don't have that, a chair or a step will work. A 5-pound weight, again, if you don't have a dumbbell, use a bottle of water or a book. Something that's about a ½ inch for some of the exercises. We like this weight, but a book or a piece of wood will work. A PT band, now these normally come in 5, so I would have all 5 to increase the intensity, and then a longer PT band. We'll try to have most of these linked in the video if you don't have them. Banded eversion. So with the affected ankle crossed over the other leg, have the band supported with the other ankle and then around your front of your foot. And you want to feel tension right here on that tendon. Now you're going to press up and hold for as long as you can. Now when you're doing this, you want your foot to stay relaxed down, don't let it come up, and your toes should be relaxed. If you're clawing with your toes, you're using the wrong muscles. So your foot is kind of pointed down, relax, press up towards the ceiling, and hold as long as you can. Isometric plantar flexion. With that same PT band in a seated position, around the middle, front of your foot, if this is the affected ankle and foot, we're gonna bring the other one up to create tension, and then press down towards the floor and hold. Again, you feel tension on the inside of your ankle on the right foot in this exercise. Progress to the isotonics or the moving exercises. So with that same position that we did with the band around your foot and on the front of your foot, if this is the affected side, we're going to press up towards the ceiling, slow tempo, 2-3 seconds, and then return to the starting position. Feel tension on the inside of your foot and ankle, and make sure your foot says relax and pointed down. Now increasing intensity over time is important, so you want to start with a 15 rep max, and then over time increase to 6 reps. So you might have to get a stiffer band or go slower. Short foot exercise. So this is to strengthen the intrinsic muscles of the foot and that tendon. Now with your foot on the ground, put that PT band right against your big toe. That'll make sense in a second here. So what you're trying to do, keeping your heel down, you're trying to lift your arch of your foot by pressing down and keeping that big base of the toe against the thing. If you're doing it right, your foot should go away from the band a little bit. Now try not to claw with your toes, but you're trying to keep your heel down, lift that arch as high as you can up, keeping your base of your mid-toe down. And again, if you're doing it right, your toes should move away from the band a little bit, and you should feel tension on the inside of that medial arch of the base of the foot. Now we're going to strengthen the big toe to help support this other tendon. So with the band around just your big toe, you're going to stabilize your ankle and then press your toes down towards the floor and then back. Sometimes it may help to actually stabilize your foot, so you just use your toe and not the muscles of your foot. But you want to feel tension right along the base of your big toe. You can curl your other toes, but try to make sure it's toe movement and not foot movement. For calf raises, we're going to give you 4 levels. For the first level, have both feet on the ground, hands supported the wall. Raise up on the balls of your feet, lift your heels as high to the ceiling. 2 things to note is make sure that the affected heel or the painful side goes up as high as a non-painful side. Sometimes when it's painful or weak, we only go up a little bit, as I demonstrate here. We want to make sure that both heels go all the way up. Second thing is keep the weight on the base of all your big toes. Don't roll out to the outside. So make sure you go all the way up, feeling tension in your calf. Tier 2. So putting that band around your midfoot with our feet shoulder width apart against the wall, we're going to let the band kind of collapse our feet inwards. And then using those muscles, we're going to pull out against the band, feeling those tendons and the intrinsic muscles of the foot engage, and then raise up and down. Making sure to feel even on the base of our toes, raise it as high as the non-affected side, and going straight up and not to the side. Tier 3 is going to be just a single leg calf raise. So against the wall again, raise up on the base of your toes, making sure to keep pressure on the inside and outside equally. Raise up as high as you can, pause, and then return to the starting position. With this one, we want to start doing a slow tempo. So up 2 or 3, pause, down 2 or 3 to increase the intensity. Up 2 or 3, pause, down 2 or 3. With the last tier, we're going to need a small weight or a book to put on that. So you're going to step on it and put the outside of your foot so it puts even more stress on that medial or longitudinal arch. Brace against the wall, raise up. It's quite challenging, and come back down. So really make sure you're braced. Sometimes you might need to leave your other foot on the ground for a sec to brace, but again, up and down. And try to make sure to go as high as you can and don't overdo it at first. This exercise is going to help strengthen the whole kinetic chain. So with the band anchored and we're going to strengthen this foot, we're going to lift up into that kind of late stage of push off. So you're going to have tension in the foot and the ankle, this foot's gonna be on the ground and relaxed, and you're gonna press the band out and hold. As you press out, you're gonna feel your core engage, and that left toe is gonna activate and building that posterior tibial tendon in the push-off. Bring back. If you wanna make it a little more challenging, you can step away from the door. Again, raise up into that late stage push-off, brace, press out, and hold. You can do reps, or you can just hold. You can lift off a little more to make it even more challenging. Now balance progression. So the first one is we're just gonna be in kind of a split stance or lunge position. You can leave your foot out a little bit, and then as you get more comfortable, bring your foot into midline and proceed to holding to 30 seconds until you can progress to the next level. After you can do that, the next level is gonna be just single leg stance and hold for 30 seconds. And then when you can accomplish that, you're gonna do that single leg and toss a light weight side to side as we demonstrate here. The last part of tendon rehab is preparing that tendon for ballistic loading like jumping, cutting, and sprinting. So here's 3 tiers of exercises to help you get the tendon ready for ballistic loading. The first one is just a jump. So with both feet on the ground, jump up as high as you can and then land softly. You can increase the intensity or the height of your jump as you feel. The second progression is lateral hopping. So standing on that leg, we're gonna jump towards midline, placing more stress on that tendon. Make sure to land as softly as you can with a stabilized foot. Increase how high you jump or how far you jump to make it harder. This progression is we're gonna use a band to make it harder. So the band around your waist anchored on the other end, we're gonna stand on the affected leg. We're gonna jump away from the anchor of the band to make it more challenging. This is gonna place more stress on the foot and ankle. Now we're talking about walking activity modifications. So with this condition, walking is gonna hurt at some point. So what you're gonna do is use your phone and calculate your steps or use some other stepometer to figure out kind of a baseline. So maybe you're walking and you find that 2,500 is about as much as I can do. Walk there and then try to gradually increase. If you go up and down in terms of how many steps you're doing day to day, the tendon's not gonna like it. It likes small increases over time. Now some other things to do to stay active are cycling, stationary bike, Nordic walking, or using aquatic therapy to kind of keep active and keep healthy for the whole body, and then slowly add walking in over time. For diagnosis of this condition, it's largely based on clinical examination. So palpation of the tendon should reproduce your pain, comparing the navicular height of the affected side versus the non-affected side. More severe cases will have swelling. There may be laxity or instability tests of the foot. You can use strength tests like double leg calf raise and single leg calf raise to compare one side to the other, also looking for collapsing of the arch, and then gait assessment. For imaging, weight-bearing foot and ankle x-rays of sagittal and AP are the best, and then MRI and ultrasound are best for assessing tendon changes, degeneration, and different grades. You've probably heard of a flat foot. So this is called the acquired adult flatfoot deformity. So if you look at our foot here, there's that medial longitudinal arch, and that tendon runs along it. Well, for a variety of reasons, it can get elongated and then start to fail. Well, this starts a mechanical cascade because when this is not supporting it, other ligaments and structures get overloaded, and when they fail, it just keeps going and going. Well, eventually what happens is when enough structures have failed, the foot collapses in. So now there's no arch, as you can see here. Well, when this side is collapsed, the stress from there goes into the outside or lateral component of the foot, which can cause other problems. Now, if this gets severe enough, there are surgical options that we're going to cover next. Now with surgery, I'm a firm believer of least invasive to most invasive. Start with the least invasive treatments and then progress to more invasive if the previous ones haven't worked. It's not black or white, there's a gray area. So don't think that you should never have surgery, but if the first thing you're doing is surgery, that's not right either. Here's 4 reasons that you should have surgery. So the first one is you've done high evidence-based rehab that has failed. This is not core work and NSAIDs and light Graston or rubbing, like strengthening the tendon has not worked and failed, surgery. Number 2 is the flat foot that we just talked about. It's so deformed that there's nothing you can do and you have to do some sort of surgery. Number 3 is the tendon's been so damaged, maybe a complete tear, that surgery is the only option. And then lastly is progressing of symptoms. Maybe the weakness is getting way worse or the pain is so unbearable or anything that you try just makes it worse, then surgery's option. Types of surgery are tendon repair, tendon transfer, osteotomy, which is a bone alignment, and then fusion of the bones. Thank you for watching our video on posterior tibialis tendon dysfunction or posterior tibial tendinopathy. We hope you found the video helpful. If so, would you like the video and subscribe to our channel? And then don't forget to check out other great videos.